My name is Dr. Joyceline Mutwiri. I come from Kenya and I work with a mission hospital called Kotelengo Mission Hospital, which is located in Meru, part of the eastern province of the country. I'm not an orthopedic surgeon, but I'm a general practitioner, as you may say. And coming from Meru, where I'm born and raised from the same region, I became a doctor a few years ago. And currently, when I became a doctor, I worked with the government hospitals, which I still work both government and the Kotelengo Mission Hospital. But for Kotelengo, I do all other orthopedic cases. So that's how I got the connection as well. So the reason I chose being a doctor was the fact that where I came from had shortages of doctors, and being in a remote area, not everyone wanted to work there. Most of the doctors want to be in a city because also the money is more and the lifestyle is much better than working in a remote area. My mission has always been for my people, and that came back many years when I was little, and I watched people suffer from my own relatives, losing my close relatives, friends. And as I grew up, I told my parents that I want to be a doctor. And lucky enough, I got the support from both my parents who are still alive, and they put me through medical school. And when I became a doctor, I went back to my home area to practice my medicine, and that's how it reached where I am. And the connection with Kotelengo came in a few years later. I came from watching patients in the government hospital on traction and skin traction for months and months in the hospital, and end up discharging my patient on a deformity, which that's not what a doctor wants to see, to the last 1 year, seeing my patient walk out of the hospital in a week's time, in less than a week, and not in any deformity. So it had been amazing. From my country, it's been growing in the last few years. The reason why they came this motorcycle business that people are using now as public means, and it wasn't there like a few years back. So the accidents were more of car accidents, which were not so bad, though they could be. But now the motorcycle accidents, we have no control. Our government has no control on them, which doesn't mean that they don't want to. I guess we live in a world where laws are broken every day. So the people who ride the motorbikes are mostly school leavers who didn't go to school or decided to quit school. So they buy the motorcycles which are being purchased like from China, India for a very low price. So they don't go for any training on how to ride the motorbike. So you just get a motorbike. Somebody else who has had the experience teaches you like for 1 week, and then you're good to go. So you have them all over the country in the remote areas where cars are not accessible. So they have the motorbikes, and they carry more than 4 people in the motorbike, and none of them, even the driver, has any protective gear. So, and they have no training on road safety. So they drive so badly. So most of my patients, almost 90%, are motorbike accidents. And that's why you see the injury is so bad, because they have no protective gears, and second, they have no training on road safety.